We know that this is a topic that when we survey our members, pain management came up quite a bit. So we'll be diving more into pain management, utilizing our integrative services that we feature even through the rest of the year. So know that we've got more segments coming this fall, just to really think outside the box in terms of different ways to help managing pain. We know that that is a big point of discussion for our members and our community.
Yeah, for sure. And of course, Erin, if you would like to share your screen, we cannot do what we do without our education sponsors. And this digital series it's so robust now. Please check out our library if you haven't. There is just so many topics that Erin and I have actually gone back and did inventory to make sure they were relevant, and they are. And it's just so impressive what our community has been able to step up and just give our areas of expertise. And we cannot make it happen without our education sponsors. So our presenting sponsors are Wes, Merck, and Daiichi Sankyo, with support coming from GSK, Lilly, Gilead, and AbbVie.
Oh, that's so grateful to them.
You know, Dr. Burgoon graduated from Vanderbilt University School of Medicine and is certified internal medicine. He's a member of the first graduating class and also formal faculty member. Chinese Acupuncture for Physicians, Scientific Basis and Practice, a course of the University of Southern California School of Medicine. Dr. Burgoon is the founding member and former president of the PA chapter of the American Academy of Medical Acupuncture, and is board certified or a board member of the American Academy of Medical Acupuncture, as well as our, of course, acupuncture advisor here at Unite for Her. He's been practicing right here in our backyard in Pennsylvania, in Westchester, since 1994. So please give me a very warm welcome to Dr. Burgoon.
Thank you, Sue. You know,
you're welcome.
I love Unite for Her. I think you're wonderful. This organization that you've created is so great to be a part of. I'm proud of what you've done, and I love being a part of it. I love being a part of it. It's an honor for me, truly. Yeah. So thank you.
Thank you for getting us there. Thank you for getting us there.
So what I want to do today is to talk about acupuncture and pain in the cancer setting. Let me first jump in and share my screen. Okay, we are right here. All right, and go to the slideshow. Sorry, let's see. Okay, here we go. Okay. All right. Now I have a chat box up on front. I'll just take that out. No, that didn't do it. There we go. Okay. Can everyone see that? And can you hear me okay?
Yep, perfect.
All right. So I've been practicing medicine for 39 years now, and 30 years I've been including acupuncture in my practice as an board certified internist. And anyway, so it turns out it's so helpful. One of the areas where it's really helpful is in the setting of cancer care. So that's what I want to talk about today, and specifically focus on pain. Let's see if I can make this slide work. There we go. So I'm just checking my time. Okay. Now, what is acupuncture? The best way to describe acupuncture, in my experience, is, of course, first to recognize that it is a system of medical therapy used in China for more than 2,500 years for the entire spectrum of human and veterinary illnesses. It utilizes small, hair-thin needles to initiate physiologic responses of repair and regulation in the body. This is what we can say from a modern perspective we know. I mentioned that it has a long history of use in both human and veterinary illnesses. Sometimes it's used as a standalone therapy. Sometimes it is used together with other therapies. Now, it has a long history of use in animals. There are 2 schools of veterinary medicine in the United States that have special programs to train veterinary doctors on how to use it effectively for their animal patients. And one of the reasons I bring this up, not just number one, because it is indeed very interesting, and the veterinarians in both of these schools are doing very interesting work with animals, but also it underscores the fact that you do not have to believe in acupuncture for it to work. Sometimes people wonder that just because it's such a different kind of therapy. So that's why I answer that question. Now, in the cancer care setting, acupuncture is now part of comprehensive cancer care in many of the most distinguished cancer hospitals in the United States. And Unite for Her is part of the force behind making that happen. Unite for Her has partnered with cancer centers since 2009. I think I have that date right, to make this therapy available to women going through breast cancer and ovarian cancer care in our area. One of these photographs here, this is from Stanford University Medical Center, Dr. Brenda Goliano. She's the director of a program there that teaches acupuncture to anesthesiologists to teach them how to use it effectively in the perioperative setting. So I just mentioned that. It's not really our topic for today, but I just mentioned it because I see the photo I have of her. Now, in 2022, the American Society of Clinical Oncology and the Society of Integrative Oncology issued new guidelines jointly on the management of pain in cancer. These were given as evidence-based recommendations for practicing physicians in oncology. They specifically recommended acupuncture for musculoskeletal pain and general pain, for joint pain related to aromatase inhibitors, and for chemotherapy-induced peripheral neuropathy, which is a very specific kind of pain. This was an important event, actually, in terms of acupuncture and helping patients and doctors to have access to it and to understand how valuable it is in this setting. Now, acupuncture's benefits in modern cancer care covers a range of types of problems encountered during cancer care. What we want to talk today about is pain. Now, this can be pain that is perioperative pain related to surgery. It can be pain related to, for instance, the aches and pains that come from aromatase inhibitors. It can be pains that predate and have nothing to do with the cancer diagnosis, but are there and are part of the patient's experience. And when we see them in the cancer setting, actually, we can treat that also, whether it's a history of headaches or migraines or various muscle and joint problems that pre-existed their cancer diagnosis. And as I said, may not have any relation at all to the cancer diagnosis. They can be treated at the same time. One of the questions people commonly ask is acupuncture painful? And so I want to point out that the acupuncture needles are quite different from the hypodermic needles most patients are familiar with. Acupuncture needles are solid, very thin, almost hair-like needles that have a gentle stimulating effect on the tissue. Most patients are really quite pleasantly surprised by the difference, and many will say that they experience only minimal sensation with the needling. The sensation experienced during acupuncture treatment is often described as an achiness, a fullness, or pressure at the acupuncture site. I wanted to let you know that in general, it's okay to feel the needling with acupuncture. In China, if the patients don't feel it, they will let the doctor know, because they know that in many settings, to have a strong feeling with the needling actually is helpful for the clinical response. But having said that, I want to also make very clear that in general, the kind of acupuncture treatments that are done in the cancer setting and in many other problems is actually quite gentle. And that gentle approach gets very good clinical results. So I'm telling you that, number one, it's okay to feel the acupuncture needling, but also it's something that you don't have to worry about. In general, the treatment is actually very gentle. I have patients who come in all the time and tell me this is the best part of my day. I treat children even sometimes, and I tell their parents they have to be willing to come in and find the value in the treatment and want to come. And indeed, that is what happens. They come in and they want to be treated, and they're happy that it helps their allergy or their asthma or their headache or abdominal pain or their sleep problems, for instance. Also, I want to let you know that if in an acupuncture treatment or during acupuncture sessions, if for some reason the sensation feels too uncomfortable, you can always ask your acupuncture doctor, can we make it a little bit less strong? There are always ways to do that. So I want to reassure you in that regard. Now, I'll show you a little example of someone being treated. This is a patient in my office who is going through cancer care and found acupuncture very, very helpful. She's being treated here for perioperative pain and for insomnia related to her cancer care. And she wanted to share her own experience by way of this video, just to be able to see a little bit what a typical acupuncture treatment looks like. So these needles that I'm using in this video are single-use sterile disposable needles. This is the standard of care for acupuncture. You see that she is relaxed and comfortable. She doesn't tense up or jump. The needles are inserted, and you see me adjusting the needles a little to assure that there's a good physiologic response taking place. The needles are typically left in place for 20 to 30 minutes, during which time the patient relaxes or dozes or reads or listens to music. When the needles are removed, there's frequently no mark left. This is quite different from hypodermic needles, which cut the skin. The acupuncture needles do not cut the skin. They penetrate the skin in a different manner that requires a special insertion technique. It's normal for there to occasionally be bruising or a drop of blood, but this is usually very mild. And I mean, you can see that sometimes because, after all, we are still putting a needle in. It's just much more gentle, and the structure of the needle and the effect on the tissue is much, much more gentle than a hypodermic needle. So this is a typical treatment. I want to just let you see that for a moment. Now, this is another example from my office. This patient, her chemotherapy was working. It was shrinking her tumor, but she was getting an extremely uncomfortable and, unfortunately, somewhat common side effect for which our oncologist, regular medicine, could not offer a good therapy. She was experiencing this burning pain with peeling and red skin in the fingers and toes as a consequence of chemotherapy for her metastatic cancer. This was termed a chemotherapy-induced neuropathy. And so I treated her twice weekly with acupuncture, and within 6 to 8 weeks, her discomfort was 98% gone. It was really very, very helpful, the acupuncture, to allow her to get the benefit of the chemotherapy, but with much, much less side effect. Now, acupuncture's proven benefits in painful conditions was one of the things that really initiated modern science to start investigating it, to try and understand how it is able to do what it does. One of the things we know from the modern studies is very clear in terms of pain. Acupuncture stimulates the synthesis and release of the body's own homemade pain-relieving substances. These are referred to as endogenous opiates in the body. And this is not a theory. We know for a fact that this is one of the many ways in which acupuncture helps. This article that I'm citing here is one I go into in depth when I talk to physicians. It's actually, this is published in one of the top international neuroscience journals, Trends in Neuroscience, and it covers 30 years of research on this topic. This is very, very important in understand. This was seminal in our beginning to understand that acupuncture has a real important physiologic basis of action. Now, this is another patient from my office. She was being treated with a type of chemotherapy, an anti-angiogenic therapy, a chemotherapy that targets the blood vessels in a tumor for, in this case, her metastatic renal cell cancer. And she was having a beneficial response in terms of her tumor. It was shrinking and responding well to the chemotherapy, but she was experiencing almost intolerable side effects. She developed, in response to the chemotherapy, a severe inflammation and pain in her feet. She had redness and swelling in her feet that couldn't tolerate any touch or pressure, and it was so bad that she couldn't wear her regular shoes. In addition, her blood pressure had always been controlled on one blood pressure medicine. Now, with the chemotherapy, she was requiring 2 blood pressure medicines because the blood pressure was going up. Both of these were well-known side effects from this type of chemotherapy. I treated her twice weekly during her chemotherapy. And with that, both the hypertension and the pain and inflammation were so much better that she was able to go back to wearing her regular shoes, and her blood pressure went back to being controlled on only 1 blood pressure medicine. Now, her problem was an inflammatory pain problem. And her experience demonstrates something else that we now know from the modern science, and that is that acupuncture turns out to have a pronounced anti-inflammatory effect. In studies on animals, using animal models that are utilized to study anti-inflammatory drugs, in the same animal models, you can demonstrate that acupuncture decreases the inflammatory markers at the same time that it decreases the animal's own experience of inflammation. The redness and the edema and the sensitivity to touch goes away. And so this evidence shows that in addition to treating pain, acupuncture can also treat the inflammation that causes many types of pain. This has also been very, very important in the modern understanding of just some of the effects of acupuncture. As we look in different systems, cardiovascular system, gastrointestinal system, inflammatory response of the human body, we find that acupuncture has really a response of benefits that is very diverse and very interesting. And I think it's part of the reason, helps us understand why acupuncture is capable of being used for such a diversity of problems in a beneficial manner. Now, in 1997, the National Institutes of Health convened a consensus panel to look at the scientific evidence for acupuncture. A year later, they published their consensus statement. It was about 8 pages. 6 pages in the Journal of the American Medical Association. And they said that the scientific evidence was such that acupuncture deserved to be included in a comprehensive treatment plan for a whole collection of common problems. Many of them actually are pain problems. These are some of the ones they mentioned: postoperative pain, postoperative dental pain, myofascial pain, fibromyalgia, headache, tennis elbow, osteoarthritis, low back pain, menstrual cramps. So you can see, actually, this was 1998. So the system as a whole has been slow to gradually respond to this very, very encouraging and important response from NIH. But this was a very seminal event in NIH, and it helped trigger the acceptance and growth in training and utilization of acupuncture that has been happening since that time. Now, I want to leave some time just for you to answer questions, for you to ask questions, and I'll answer them, or however. And so I'll just mention before I stop talking that you can learn more about acupuncture at the Unite for Her website. And if you decide to choose acupuncture as one of the therapies to help you, look at the list of providers. We have an excellent list of providers that we have tried to make convenient for all the different cancer centers that we partner with. Choose someone who is convenient to you, because you can see that you might be going twice a week for a while to be treated in order to get benefit from the treatment. So I encourage you to do that. And now I think actually I'll stop talking, and I'm going to take off my sharing screen and just take a look at you, and I'll be happy to answer any questions you might have. Yeah.
Oh, thank you, Dr. Burgoon. That was wonderful. And I'm glad you mentioned our provider list and vetted providers. And we know that we serve nationwide. Acupuncture is part of our wellness program locally. But certainly we know that acupuncturists may be part of an oncology center nationwide. So for those that are outside of our local region that we are serving, are there any places that you recommend our members that are part of our national program could go to find a vetted acupuncturist in their area that they may see?
Outside of our local area, yes. If you're in the New York area, certainly they can check out Memorial Sloan Kettering. Memorial Sloan Kettering has a strong commitment to integrative care. And one of our former providers, when he was living in the Philadelphia area, Dr. Jun Mao, a University of Pennsylvania doctor at that time, is now the director of their integrative healthcare cancer center. And that is certainly one area. If you're in the area of Dana-Farber Cancer Institute, they also have a strong program there. And they've done important work both in terms of cancer and some other problems related to acupuncture. That's two.
I was going to say also, is there a listing as part of the American Academy of Medical Acupuncture that individuals could find regional professionals?
You can, yes, at medicalacupuncture.org. This is the national website for the American Academy of Medical Acupuncture. This is the largest organization of physician acupuncturists in the US. You can certainly check there. When you do, you would want to, if you check with the doctor and ask about his experience treating patients with cancer. And yes, and there are even some who are oncologists, for instance.
Perfect.
Also, where else in the country? Certainly at University of Texas, there are some people doing some good work there. Baylor University, Baylor Cancer Center or Medical Center, University of Texas also. Yeah, do look, because actually it has become quite common, and I'm happy to say that Unite for Her has been part of the force making that happen around the country.
Perfect.
Yeah. We had a couple of questions, and I tried to answer them in the chat too, Dr. Burgoon. One was just asking about our provider list. So I gave everybody the access. We're in 3 states for those of you that are nationwide. We're in every state, but 3 states that we actually do acupuncture. And that's why you're seeing that provider list go into the chat. But so please take a look there. And like Dr. Burgoon said, they're all vetted. Most are MDs, but some, maybe there's a few that might not be, but they had the credentialing that Dr. Burgoon felt strongly about being on our list. And then I did put that in the chat as well, Dr. Burgoon, that you talked about the medicalacupuncture.org for them to take a look there, because we are in every state. We know that people are joining us from all over. One of the other questions was, do you know if acupuncture is covered by insurance? And this is why, we wanted to create a community at Unite for Her that we could cover that cost, because not all insurance covers it. So Dr. Burgoon, can you speak to that a little bit? I feel like a couple have made some headway. Medicare, I know, possibly in Philadelphia, made some headway with some treatments. I think they have to check out their insurance, but can you speak to that?
Yeah, thank you, Sue. That's such an important question. It was something that in the NIH consensus statement in 1998, they mentioned the lack of insurance coverage is a barrier. And they mentioned this needs to be addressed. Now, for the last 30 years, whether or not your insurance covered acupuncture or not depended really where you were in the country. If you're living in California, Washington, Oregon, chances are your regular medical insurance would cover acupuncture. Elsewhere, it varied. I was on faculty for about 5 years at the New Jersey School of Medicine and Dentistry. They had asked me to help create an integrated medical office for them. This was in the 90s. And during that time, at that time, the Cooper University Medical Center was the biggest employer in South Jersey, and they were self-insured for medical care for all their employees. They covered acupuncture, that healthcare system, part of UMDNJ, University of Medicine and Dentistry, New Jersey. They covered acupuncture for their employees for any problem. And it wasn't just because I was there. There were several doctors who told them this is a good idea. So when I was there, I saw everybody, actually from the cook to the cardiologist, for acupuncture. The doctor who was head of the pain management service at that time at Cooper University Medical Center was my acupuncture patient for pain. And so that shows you how wide a difference there can be in coverage. Now, in 2020, January or February of 2020, Medicare decided to cover acupuncture for a very specific indication, low back pain, that has a very specific chronic low back pain for a specific under a specific description for Medicare recipients. That is progress. Aetna insurance company has had a clinical policy bulletin on acupuncture for about 20 years, in which they stated that acupuncture is they recognize it as medically necessary, and they listed about 8 conditions. They were conditions like TMJ, chronic knee pain, osteoarthritis of the hip, chronic low back pain, migraine headaches. At that time, 20 years ago, they were not routinely covering. They would just recognize that it was medically necessary and would consider it in certain circumstances. A year ago, they posted a bulletin saying that they were going to make that coverage part of their regular insurance coverage. Now, I don't know where they stand on cancer care. I will say this, and this is the last thing I'll say about the insurance, unless you have more questions, but so much of insurance coverage, medical insurance, comes through the workplace. And this happens, there's a dynamic involved in which someone, usually at Human Resources, works with insurance brokers in the field who set up insurance programs for an employer, and they'll tell the employer, have your benefits day, and we'll be there to help your employees understand the different plans and choose one that they want. So that person in your human resources department who works with the insurance brokers, this is an important meeting point, because you can go to that person and tell them, we want our medical insurance to cover acupuncture. We want it to cover by qualified providers, by physician providers. We don't want it to be some kind of a special discount plan or something. We want it to be regular coverage. And you can amplify your voice. One person going, because of the focal point that the person at Human Resources functions as in terms of getting the employer insurance plans, you can amplify your voice in a powerful way. This is a very important thing to know about. The science is there. You can see in terms of cancer care. Here's the Society for Clinical Oncology and the Society for Integrative Oncology issuing joint guidelines saying, telling physicians, this is important therapy. So the science is there. The science is there for many, many conditions, not just in cancer care. So you can go confidently. And if you go and your human resources person says something like, or their insurance broker says something like, well, that's still too experimental. There's not science yet on that. I invite you to call me, okay? Because I will help you if that happens. I'll be happy to talk to the insurance broker or to the human resources person and help them understand that there is a lot of science and help if that were to be a problem. I offer that to you.
Yeah. Dr. Burgoon, would you be comfortable answering some questions in the chat for us? We have quite a few there for you.
Oh,
And
yeah,
if
sure.
you,
Absolutely.
would that be okay? Because we
Yes,
do have
yes.
quite a few, and you're so helpful, and I want you to answer them. Like, I know the answers because I've worked with you for so long. I'm like, oh, I can put that in there, but they have to come from you. So if you could please
Okay.
put them in there for us. And then Aaron, would you like to bring on our next speaker? And Dr. Burgoon, thank you so much for
My
being here
pleasure,
with
Sue.
us. It's
Totally my
such a,
pleasure. Thank you,
yes.
Aaron. Thank
I
you all
think
for
we're going to
being
have to
here.
have a phase two, another session, right? So we can answer all these questions. But
Yeah,
if you can get to
anytime.
them all, and then maybe at the end we'll have a little bit of time as well.
Okay.
Yeah.
I'm going to go ahead and mute myself and go ahead and look at the chat.
Perfect. Thank you. Thank you.
All right. Thanks, Dr. Burgoon. Well, I am very excited to have our next speaker who will be talking about, let me bring him on, Dr. Wang, talking about Reiki for pain management. So again, we're really focusing on different integrative therapies, how they can be part of your arsenal. We know pain comes up so often. So it is truly my pleasure to introduce Dr. Joseph Wang. He graduated from LaSalle University with a bachelor's in biology. He continued on to the University of Bridgeport for his doctorate in chiropractic medicine, and then received his doctorate in physical therapy from Newman University. He has more than 20 years of outpatient experience, specializing in neuromuscular conditions, injuries, and trauma. He has experience in stroke rehabilitation, traumatic brain injury, spinal cord injury, sports injury, post-surgical rehabilitation, geriatric health, headaches, vertigo, chronic and acute pain to the spine and extremities. He has extensive certifications for various treatments and therapies and is certified in hypnotherapy, quantum healing hypnosis therapy. He's a Reiki master, Tai Chi Chuan, and I don't know if I said that correctly, so please forgive me. And he is a Qigong instructor. So much to bring to the table. I know you'll be focusing on Reiki, but clearly that expertise and practice, we're so excited to have you as part of our provider network. So it is truly my pleasure to introduce Dr. Wang this evening. Thank you so much.
Thank you, Erin. I guess I'll pull up the slides and get that started. Do I just hit share? And
yep, you can share screen. Yeah, absolutely.
Perfect. Okay, so that's okay. Is that on?
Yes, and then you can start your slideshow. Yep, looks great.
Great. Okay. And good.
Perfect.
Okay, here to do the Reiki presentation again. Thank you, Erin, for the introduction. Reiki, I've been certified since the late 90s, and I've been incorporating Reiki into my practice ever since. And Reiki is a little bit nebulous to discuss, so I'll do my best to give my perspective on my understanding of Reiki as it ties in with this notion of a universal breath, a universal healing force that flows through us. And a Reiki practitioner will channel this type of energy through them as they're working on clients or patients. So again, Reiki is a universal life force energy. It's a non-physical, ubiquitous energy that has the power to heal and influence life. It's known as Ki, Chi, Prana, Holy Spirit, depending on what culture you're from. It's an energy that flows inside all of us. And I think this is the part where it's a little tough for people to understand that concept. It's Reiki, Tai Chi, Feng Shui, meditation, yoga, including acupuncture. They all help to control and enhance the flow of this universal life energy. So Reiki is a form of hands-on healing, and its origins date back to India and the East before Buddha and the Christ. The original knowledge was lost. They're not really sure where Reiki came from, but it was rediscovered by Dr. Miko Usui, who coined the term Reiki, right? It's broken into two words. The Japanese word Rei stands for universal, and Ki is life force. So Rei is equivalent to, like earlier you said, Tai Chi Chuan. Tai Chi is also in Chinese, it stands for Rei. Tai is Rei, is universal energy, this universal omnipresent spiritual consciousness that flows. And Qi or Qi, it's equivalent. Qi is used in Chinese word to describe the flow of life, right? In acupuncture, they always talk about the flow of restoring Qi flow. So it's energy with regards to nerve flow, oxygenation, blood flow. Everything that gives us life is Qi, Ki, prana, and that's the Reiki together talks about this universal breath. So when I teach Tai Chi or Qigong, we always talk about it from the presence of allowing this universal breath to flow through us. So obviously when the universal breath or this Qi flow is high in us, it allows health to flow through us. And sure enough, our immune system is strong and it protects us and keeps our body strong, right? Our internal pressure needs to be stronger than the external pressure. When our Qi is low, and we've all experienced low energy days where we just feel lethargic and you can feel the wind, feel the heat, and like everything seems to affect us. But when our Qi is strong, like our energy is up, you could walk out there, the weather doesn't affect us, like our body just feels good. You could be around people that are sick and coughing and it doesn't affect you because your Qi energy is higher. Your internal pressure is greater than the atmospheric pressure. Your energy is stronger. It has a tendency to be able to repel and keep things from coming in. Again, when the Qi is low, people tend to get sick. So Reiki, it stimulates a person's natural healing ability, right? So when the energy is flowing, your own immune system is strong and your body's ability to heal becomes faster. So Reiki is now practiced and researched, very well researched. If you ever look it up online through PubMed, you'll find thousands upon thousands of medical articles on Reiki and just hands-on healing. And they use Reiki in hospitals. They use it for wound healing, definitely for pain control, depression, stress. Again, if you think about it, if you restore life energy flow to a person, where if a person is injured, or they've gone through surgery or chemo or other types of disorders that has blocked energy in the body, where the energy is stagnated. Well, how will we open that, right? We allow Reiki to come in, and I'll go over that in a minute, to open up the channels. And when the channel is flowing inside of a person, then their own body's homeostasis can come back. So they talk about Reiki. If you talk to other Reiki practitioners, they'll mention this unconditional love and joyful bliss that connects all living things and to flow through us. I have a tendency of needing to understand it more on a scientific level, but when you do start practicing Reiki, there is this euphoric energy that flows through you. You just feel that everything is better. When your energy is high, everything just feels better. Your mind is more positive. So how Reiki works, it works on the premise that the human body and pretty much everything around us is made up of energy. Based on our current understanding of quantum physics, everything breaks down into energy, breaks down into fractals. And it's this energy that connects all living things in this universe. And Reiki essentially comes down to our genetic structure. It stimulates growth, life, health, healing. So in terms of poor life habits and choice that stifles the flow of Reiki or the flow of energy, besides this poor life, for example, people that smoke, do drugs and such, or having undergone chemo, surgery, trauma, all these things can stifle the flow of energy in the body. So when we work with Reiki, our goal is to work with the energy channels, we so-called chakras. There are 7 main energy chakras on the body. And a full Reiki treatment works to balance out the chakras so that it rebalances the mind, body, and spirit. And it will stimulate the immune system, again, removing toxins from the body. And when people do receive Reiki treatments, there are moments where people will ask, am I going to feel anything? When a person's body is very sick and the energy is very low and the energy has been blocked, and a Reiki practitioner starts working to open up the energy, sure, the body has the potential to go through detoxification. So the body may feel sick as the channels open and the toxin starts flowing out. They may go through detox reactions where they may have chills, the temperature fluctuates, they may go to the bathroom quite a bit to just flush out the toxins from the body. So those are just a few of the many different sensations that a person may go through as the body tries to restore its homeostatic balance. This is just a picture taken from Alex Gray's book. It gives you an idea of what the energetic anatomy looks like. You can see the different chakras working from the base chakra through the crown chakra. You can also see the white lines and dots there that represents the meridian channels. And I like this picture because it has that outside web connection where you can see how this energetic connection intertwines and connects all of us. That was more of a biophysical picture. This is kind of like biophysical and biochemical combined, where you can see how the first chakra correlates to the coccygeal plexus. The second chakra correlates to the hypogastric plexus. Third chakra, solar plexus. Fourth one, the cardiopulmonary plexus. Fifth one, the thyroid plexus. Sixth chakra to the pituitary, thalamus, amygdala, hippocampal plexus. And the seventh chakra to the pineal gland. And the goal of working with this, we will put our hands over these chakra points to help restore this balance in the body. Now, people ask, well, how does Reiki work in terms of what is this flow? What is this energy that's coming from a Reiki practitioner? It's an attunement. A Reiki practitioner goes through this attunement process as they become, certified from Reiki level 1 through 3. There's symbols that are given. And from my understanding of these symbols that are given, it's more of a frequency that's tuned to the practitioner. Now, anyone can learn Reiki, right? Once you become attuned to this frequency, your body can now vacillate and your mind can come into this state of mind and channel through your body, your hands, from one practitioner to another, from your own hands to yourself. You can work and put your hands on the various chakra points to reattune and rebalance your body. This is just a picture of the various frequencies around us. As you can see, pre-technology, right? The frequencies, you have your Earth, natural magnetic field, lightning, visible light, X-rays, comic rays. Now we're bombarded with various frequencies, right? I mean, this is just some in terms of electrical power, high voltage lines. I mean, everybody's familiar with that. Like, you can't pay me enough to live near a high voltage line, right? It's just, there's dangers to that. It's just, then you have your military waves, the VHF beacon, AM, FM, short waves, TV waves, microwaves. And now we have Wi-Fi, cellular frequencies, right? So we're exposed to a lot more frequencies today, some of which obviously are more harmful than others. But knowing that frequencies can harm, we also know that there's frequencies that can heal. And Reiki is among the frequencies that do heal and help the body. Just another example of frequencies, right? This is the classic example where most people understand it, such as beta, alpha, theta, delta. Right now, I'm engaged in the beta wave where I'm thinking and my mind is active as I'm thinking about what to say next. Alpha is the frequency that we want to get into when we start doing Reiki. That's the frequency you get into when you're doing meditation, when you're doing yoga, when you're doing Tai Chi, and so on. And that's the frequency that you really want to be in on a more regular basis. It's a very chill frequency. Theta is the dream state frequency, and delta is deep sleep. A Reiki practitioner's goal is to try and get into the alpha theta frequency. And in that frequency, they then channel to the specific Reiki frequency, where then this frequency goes through the practitioner's hands and their very being, and their presence being around you, they will start to attune your body's frequency. And their hands will move throughout your body to find the areas of blockages. Again, a Reiki practitioner, their hands over time become sensitive as they move their hand over your body they have a tendency to be able to feel the areas of stagnation. And for me, if I touch a person as I move my hand over areas of stagnation, it just has a tendency of feeling sticky, right? It's kind of like moving your hand through mud rather than just smooth water. But that's, every practitioner has different sense and capabilities and descriptions of how energy is felt. Again, the therapeutic emission, as the practitioner then goes into this mindset of Reiki frequency, they channel through the hands and then to the injured area for repair. Okay, you see another picture of it where the practitioner connects the hand and focusing on the frequency, it channels into the person itself and how it affects us on a cellular level, right? You have your typical model of the antigen to the receptor for cellular function. You can also see that frequency has the same ability to channel and affect the receptor sites. So on that level, it gives you an idea of how it works down to a cellular level. Now, I'm going to pull out of this screen and back to. So I'm going to do a little demonstration so that we can all join in and have an idea of how Reiki feels. And I also wanted, before I do that, just to touch upon the fact that there are Reiki practitioners out there that can do distant Reiki, and that's something that's done also with the same intention of understanding that it works on this cellular frequency. So if I'm doing distance frequency healing, and for example, Aaron, if we're doing distant Reiki with you, I would tell you, it's like, okay, I'm going to work on you on this specific date and time. And I would recommend that you be rested during that time and not driving or operating any vehicles. And my job at that point will be dialing into you, right? I will be thinking about you and focusing in on you during that time. And most people can relate to this because we've all had those moments where we think of someone and all of a sudden that person calls us, right? That's a dial-in moment, right? And most of the time it'll be friends and family that will be dialing in. If I just thought about you, Aaron, on a like arbitrary moment, right? Pop into your head and you'd be like, oh, who's that, right? You just kind of dismiss it, right? But if we knew each other well and I think about you, all of a sudden you pick that up. It's like, oh, it's like Joe's popping into my head. Let me give him a call, right? That's sort of how this distant Reiki healing works, and in a very broad spectrum. We focus on you, we focus on you at that moment. It's just you and I agreeing to connect at that time, where I then focus my healing on your virtual body in my mind, and that's how that distance healing works. To the best of my ability to explain that, at least that's my understanding of how that works. So I want people to have a feel of how this energy, this chi flows. So let's give this a try, okay? First, it's important just to get relaxed. You could obviously be seated. Change the mindset, okay? Let the mind relax. Put all the stress and worries to the side for now, okay? You can pick that up later. Just drop it off to the side. Be in the moment with me. Focus on the breath. Deep breath in. Out, and allow yourself to relax. Actively breathe. And every time you breathe out, relax more. And we're going to put our hands together, focusing on breath. And we're going to rub our hands together gently to the point where you feel your hands. Okay, and you can feel the sensation between your hands. Breathing in, out, and relaxing more. And you're going to feel your hands rubbing together and noticing the sensation between your hands, to the point where you feel like every little groove on your skin, paying attention to the sensation between your skin, your hands. And as you continue to rub your hands together, you're going to start to slowly separate the hands, ever so gently, to the point where they're still touching, but barely. And then you can still feel them. And as you start to separate more and more, you can still feel there's a connection between your hands. You can still feel the sensation between your hands, and yet they're not touching. And now you're starting to feel this almost like cotton candy sensation between your hands. Because our mind doesn't have much of a template for how energy should feel, it comes across almost as heat, right? But it's something there. And as you gently push your hands together without touching, you feel like there's, right, a cushion of air between your hands, a cushion of heat. For me, it kind of always feels like warm cotton candy. And as you breathe and relax and let this energy grow, you focus your intention on love, on all the good things in life, all the beauty, light, and love. Breathe in, breathe out, relax, and let this energy grow. And you still check, and you can still feel this energy between your hands. It's like a ball, and it seems to be moving on its own as your hand is just carried by this energy as it gets larger and larger. And you see it in your mind's eye, this ball of energy between your hands that's invisible and yet visible to the touch between your hands. And you're going to take this ball of energy, and if you have pain anywhere on your body, you're going to take that ball of energy and put it to the area that you have pain or discomfort. If you do not, just take this ball of energy, we're going to just put it to our heart chakra and place it into our heart chakra. And just hold and feel that energy come in and spread and grow and spread itself from that point through the rest of the body. And you can feel the way the heart chakra from there spreading up and down the body, into the body. As if it tunes the body with this frequency of love. It's a blissful, comfort energy. And it'll start to open up. And you can then move from that point to other various chakras on the body, to the solar plexus, right? You can go lower to the lower abdominal region, over your belly button, one hand over the solar plexus. And you can work with different points on the body, right? If you want, you can work right around your neck area, over the sixth chakra, over the eyes, is one of the easiest to feel because the eyes are very sensitive to energy. At nighttime, when you have difficulty sleeping, this is a good chakra to work with, keeping your hands right over the eyes. Also good for the eyes, right? Palming, they call it. You palm the eyes to help the eyes dilate because our eyes are constantly affected by blue light. And when your palms are over your eyes, it helps the eyes to dilate, allowing it to relax, to open. And it's actually very healthy for the eyes, for the ciliary muscles to just relax. Breathe in, breathe out, and relax. This is something you can do on a daily basis. You're ready. Allow yourself to relax. Come back. Breath in and out. And you can just spend just a few minutes each day practicing this, cleansing your body, cleansing your mind, balancing your energy. And the more you do Reiki, the more you channel into this frequency, the better your body will feel, the better your body will heal, and allows your body to come back into balance. Now in Tai Chi, we do the same. We channel, we ground ourselves, and if you notice Tai Chi practitioners, they're in this state of mind. You have to be in an alpha state of mind, and then you slowly move your body and you let the energy flow through your body. Reiki works a little bit differently in the sense that we're not moving so much as more just feeling with our hands and using our hands and channeling and balancing the body. And there's all different forms of hands-on healing. Reiki is one of them that's been out there, tested, and obviously examined very well with time. And time is the best test. And people have recovered, especially when the energy is flowing. Pain will naturally go away as the body returns back to a state of balance. What? Yeah, any questions? I could go on and on about Reiki and many other forms of energy healing, but I'm trying to stay with the Reiki.
It was very good. I very much enjoyed that because I had some pain in my hip from sitting all day at my desk. And I actually did that exercise and put it onto my hip, and it like I feel a little lighter, feel a little like I'm not feeling that where it was sort of throbbing, while we were sitting on the call.
Yes.
I thought that was really interesting because I haven't dove into Reiki the way I dive into some of the other therapies.
Oh, good. Sitting is one of the worst things we can do to ourselves because it stagnates energy. It doesn't allow energy to flow. And when you do put your hands on it, it finally allows the energy to flow, and you feel better when the energy is flowing and not stagnated.
Yeah.
Thank you.
So good.
Thank you for that, Sue.
Yeah, it was so good. I did have one more observation I wanted to tell you. When I put my hands over my face, the color was blue.
Yes. People see different colors. Usually when we do Reiki, many people report of seeing various colors ranging from purple to blue to yellow, and some people see spectrums of colors.
Yeah.
But the palming is something that you should just do in general, whether it's Reiki or not. They have eye therapy exercises where palming is number one, right? By allowing the eyes to go dark, you actually allow your pupils to dilate, so it's not so constricted. And obviously this would help when you go to restaurants, so you don't have to look at the menus with lights and reading glasses.
Right.
But it allows your eyes to see better.
Yeah, it was really a wonderful experience. Thank you. Especially that we can do it over Zoom is amazing.
Yes. Yeah. Any other questions?
We did have one member in the chat that learned Reiki almost 20 years back. Can they still channel it?
Oh, yes, of course. Once you're attuned for life, right? It stays with you. It's just a matter of bringing up the symbols again and thinking on it and practicing with it. And the more you practice with it, the better, right? It's just like tuning into like an old-fashioned radio. It takes a bit, right, at the beginning. And the more you tune, the clearer the channel becomes. But it's daily practice.
Very good.
Wonderful. Yeah. And we do have providers for our local and our national program. So, yep. So if Reiki is something that you're interested in trying, definitely look at our provider list. You can use your squares and like Dr. Wang said, the virtual option is still just as effective. So hopefully this will open up some more opportunity, especially in the pain management, but also extending far beyond that.
Yes.
Yeah, I'm grateful that we can share how well the virtual Reiki can work. So, and you do that virtually as well. So one of our providers, you can get on our list, you can use your passport, and then we end up paying for that cost if you're an active passport user. Wonderful. Yeah, good. Well, thank you very much. Thank you again, Dr. Wang. We appreciate you.
Thank you, Sue. Thank you, Aaron.
Thank you,
everyone.
All right.
Well, that was so good, Aaron.
What great learning. Yeah. Hopefully this really brings a totally different context to some of these other integrative therapies that are available to us, and really thinking outside the box to make this part of your comprehensive care plan.
Yeah. I see Dr. Burgoon is in there typing away, answering these questions so thoughtfully. So remember, if Dr. Burgoon didn't get to your question, we have them copied down, and we will add them to the chat when Rachel ends up putting up the actual video, Aaron. Let's make sure we have the questions answered. The one that, asks about how much does acupuncture hurt, I'm going to answer that one for you, Dr. Burgoon. It does not hurt. You have been through so much. I cannot tell you. It is nothing. Like, think of a little pinch or a little, once in a while I end up getting a really deep acupuncture needle that needles and can like hit a point for me that I'm like, oh wow, like that was sharp, but then it goes away. And the result is this care and opening up the channels. And just like Dr. Burgoon talked about, that in Chinese medicine, we want to feel something. So it's okay. It should not deter you. It absolutely not. It is the size of a hair, those needles. And it is truly why I created Unite for Her. I can't say that enough. It is truly why Unite for Her was founded, because of all the knowledge I just felt was missing in that community. So hopefully that helps you figure that out, Jigna.
Yeah. Wonderful. And be on the lookout. Like I said, we're really tapping into different ways to approach pain management with these different integrative therapies. So certainly know that we'll be continuing this conversation later this year with more virtual hangouts, because again, all of the tools are helpful. So there are lots of different avenues that a patient, a member can take to help yourself. So hopefully you find this beneficial.
Yeah, absolutely. Well, there we go. June, our first one. Tomorrow we'll be back. Please join us.
We will be back.
Aaron and I will be here. Yeah.
We sure will.
And we want to thank our sponsors once again, right, Aaron? So we just are so grateful. We actually got to see a lot of these partners at ASCO this past weekend. We were at the largest cancer symposium conference globally, right there in Chicago, where all the finest research and science is presented, but we also get to meet with our partners, and all they're committed to Unite for Her. We are grateful. We are grateful. They love our work, and it shows through what they end up doing to support our work, and then we turn it around and support more in our community. So a big shout out again to our presenting sponsors, West, Merck, and Daiichi Sankyo, with additional support from GSK, Lilly, Gilead, and AbbVie.
Wonderful. Yep. And remember, we have our speaker series tomorrow evening, BRCA and breast cancer in men, and our virtual hangout number 2 of the month next week, same time and day, Wednesday, 5 p.m. Eastern time. You'll see our entire culinary team. We're playing with summer berries, and we will be bartending and kicking off with a little mixology with a bartender from Ritual, which is a zero proof brand. So lots of fun summer mocktails coming at you throughout June, July, and August. But hopefully we will see you tomorrow evening. And if not, you'll be able to come back and rewatch this segment, certainly share with others.
For sure.
Always good to share the wealth.
Yeah, I agree. Erin, do you need a sous chef for your nutrition segment? A sous chef?
We might.
No, I'm available.
I think I know someone who's pretty good at it.
Just saying. Yep. All right, everybody, have a good night. Thank you for joining us. Yeah,
thanks everyone. Thank you, Dr. Burgoon. Thanks, Dr. Wang.
Yeah, we'll hold on a little bit. I see Dr. Burgoon is still busy in that chat, so we'll stay on. The rest of you can, you can come off if you need to, but we'll hang on. Dr. Burgoon, did you get to everybody?
Hi, Sue. I did.
Hi.
I made the mistake first of answering the questions directly instead of pushing it to everyone.
I figured you did.
And I had to go back and try and paste those answers out and put them in for everyone. So I think I got them all. There might be a few typos here or there, but I hope I was able to answer a lot of good questions. So
many good questions. And like everybody, other people have the same questions. So like, oh, right, I want to learn about that. So thank you for taking the time to do that for us. We appreciate it.
My pleasure. Nice to see you both.
Nice to see you.
Thank you.
So much.
I miss you, Dr. Burgoon. I gotta get myself in there.
Always nice to see you both. Take care.
Alrighty.